Welcome everyone to Digital Virtuosity. My name is Mike Anderson. I'm the founder and CTO of Telium, and I'm joined today with the founders of Presidium Health. We're going to talk about providing care in the digital healthcare revolution. Gentlemen, I'll hand it over to you, and I'll be back in a bit for some Q&A.
My name is Puya Afshar, and I'm the CEO and co-founder of Presidium Health. Joining us today is our co-founder and chief medical officer, Ashkan Hayat Davudi. We're both practicing physicians, and our inspiration for this journey came from our direct observation of patients across the multiple layers of healthcare. Presidium Health is a San Diego-based healthcare company that provides a home-based, tech-enabled model of care with a particular focus on servicing medically complex patients. These are obviously some very interesting times, and we've reached a point where healthcare is under a great deal of scrutiny, exposing many of the industry's weaknesses. The reality is, healthcare was actually ripe for disruption prior to the COVID-19 pandemic. Traditionally, healthcare has been a very complex industry where the typical market forces haven't been able to penetrate, making change a very difficult and slow process. Prior to COVID-19, digital transformation, telehealth, and other digital health solutions were a nice-to-have feature. But now the pandemic is serving as a catalyst for rapid change. We're now in a position where clinicians and health systems have to pivot, breaking down any barriers and allowing for the rapid deployment of digital health services. Perhaps one of the most striking examples of the sudden change in digital health policies is in the area of telehealth. In its most basic form, telehealth is defined as the ability for clinicians to render care without a face-to-face visit. Prior to COVID-19, telehealth was a billable service reserved for only rural areas of our country with highly scrutinized HIPAA security requirements and medical licenses that didn't cross state lines. Now that we've seen almost every doctor's office closing their doors, telehealth is available anywhere in this country on virtually any platform, regardless of security features that allow for two-way video or audio communication. Even more impressive, as a physician licensed in the state of California, my medical license is now valid in all 50 states, allowing me to provide telehealth to anyone, anywhere in this country. As a company, we've seen this coming. Perhaps not at this accelerated pace, but we've always questioned the fundamental concept that shifted healthcare away from the home and into the high cost, high risk, institutional setting of the ER in the hospital. The floodgates opening for telehealth give us a glimpse into the digital healthcare revolution. Beyond telehealth, digital healthcare is a very competitive and crowded market filled with everything from wearable devices, on-demand medical care, portable health records, and ultimately pointing to a world of AI-driven healthcare. While there are a lot of innovative companies focused on building a technology platform and cramming it into the healthcare arena, our strategy has been more of a traditional get to know your customer approach and letting the service needs drive the appropriate technology. We quickly realized that downloading an app on a smartphone or navigating the vitals on a smartwatch wasn't really the solution for many of our elderly, frail patients. We've now amassed 5 years worth of user stories and use cases as we've provided 24/7 mobile medical services with boots on the ground that deliver a very basic and tangible service to thousands of patients. And in the process, we figured out the logistics, how to bring healthcare to the home, including not just the doctor, but all the ancillary services such as x-rays, labs, and medications. And we've done it with a financial model that works within the boundaries of health insurance, that doesn't label us as a concierge service, avoids any out-of-pocket expense to the patient, and gives us the true privilege to deliver our services to the most underserved populations. If we look back prior to the COVID-19 outbreak, healthcare in the United States was on a path of unsustainability. We spend nearly $4 trillion per year on healthcare, by far more than any other country in the world. Yet many of the metrics that serve as a proxy for healthcare outcomes, including the healthcare index rating, show that we rank dead last amongst developed countries. As I mentioned, there are different ways to measure healthcare outcomes. One of the most revealing metrics are the leading causes of death in the United States. In 2014, the CDC published data that showed that after heart disease and cancer, medical errors account for the number 3 cause of death in the United States, with most of those errors occurring in the high cost setting of the ER and the hospital. So where is the problem and what is the fix? Well, one of the most basic issues with our current healthcare system is limited access to care and the downstream effects this has on cost and outcomes. In the United States, we're now accustomed to Amazon delivering a package to our doorstep within a couple hours, yet it still takes on average about a month for a patient to make an appointment just to speak to their primary care physician. This is especially problematic in the high-risk, medically complex, elderly patient population that we serve as a company. A 30-day window to see a physician makes these patients highly dependent on utilizing 911 and trapping them in a vicious cycle from home to the ER, nursing home, over and over and over again. It wasn't always like this. Historically speaking, if we look at the evolution of healthcare, let's say 40, 50 years ago, physicians practiced in a much simpler, low-tech world where they saw fewer patients on a daily basis and had more ownership of their patients. While they may not have had access to some of the CT scans, MRIs, or sophisticated lab studies, they made themselves available to their patients 24/7, made same-day appointments, and even picked up the phone when there was a crisis. From a customer standpoint, the patient experience was extremely favorable. Now, if we look at today's highly fragmented model of healthcare, the primary care physician's role has been limited to one where they essentially serve as a wellness doctor. You see your doctor once a year for a checkup and some labs, and if and when there's a crisis, access is extremely limited, and patients are often advised to go to the ER or the hospital. So while we've evolved to using more sophisticated high-tech services, it's come at the price of raising the cost of care and reducing accessibility. Over time, this change has dramatically lowered customer satisfaction, driving down the value proposition. So if we can for a moment, project into the future and imagine the ideal scenario, we'd envision healthcare to continue on its path of developing more advanced diagnostic and treatment options while simultaneously improving access to healthcare. We'd reintroduce the bond between patient and physician, improve outcomes while lowering cost. This gets us to the holy grail of healthcare, referred to as the triple aim: better patient care, better outcomes at a lower cost. To make this triple aim attainable, we'll need to transform the industry through the adoption of digital healthcare solutions.
Afshar, for taking us through this journey of healthcare's past, present, and future. Also, a quick thank you to the Tilium team for providing this platform to bring all these data illusionaries together, providing us with some much needed content during these trying times. Tilium, we appreciate you. As Dr. Afshar noted, the path to the future of healthcare is digital healthcare. Yet, we need not forget the lessons of the past. Despite our current state of high cost and low access, we know at one point we were providing efficient access to healthcare. What can we learn from that period? Are these strategies to build on? Indeed, our goals for the future parallel those of the past. Then, by definition, the only remaining variable, technology, is the great facilitator. The facilitator to what, you say? Well, ultimately, to easing our journey back to the future of healthcare. In Back to the Future, a young Marty McFly traveled into the past where he used his knowledge of past and future events in order to correct issues in the present. At Presidium, we likewise have learned from the past and can envision the corrected future. We feel privileged in taking part and making a better present. The solution, as previously noted, is the utilization of technology to ultimately automate healthcare systems. This will lead to improved access to care, which will in turn lead to less hospitalizations. And as Dr. Afshar just informed us, will also lead to decreased error as nature of those decreased hospitalizations. Finally, the coup d'etat, improved outcomes, lowered costs. Much like Doc and Marty, at Presidium Health, we understand that the digitization of healthcare must start with the building blocks we already have established. The medical history, the most simple of tools available to the clinician, yet also the most effective. Each time we go to our clinician for a visit, they ask us a series of obscure questions. How old are you? What drugs or alcohol are you using, if any? Any sick contacts? What medications are you taking? These, my fellow data illusionaries, are the most precious of structured data points. The clinician oftentimes, without knowing, takes this data in, subconsciously synthesizes it, then plugs it into a decision tree, which ultimately drives their assessment and recommendations. Whether we in the field of medicine realize it or not, this is data-driven decision-making in its purest form. This is the base of what will ultimately serve the digital health revolution. We are taking structured data from different categories such as demographics, real-time data including vitals, and population-based data in order to synthesize the best plan possible to care for our patients. At Presidium Health, we understand the value of these data points as it relates to patient care in the current, and more importantly, the value behind the interconnectivity of these data points in driving therapy in the future while leveraging artificial learning. We began our journey at Presidium to affect healthcare with the basic thesis that we required service-directed technology, which is going to be the future of healthcare. In the spirit of service-directed technology, early on we utilized a strictly manual process to learn all nuances for what we were trying to achieve. We provided our patients and partnered medical groups access to a triage care operator 24 hours a day, 7 days a week, 365 days a year for the past 4 years. We urged our patients, use this line for any questions or concerns you may have. Our goal, that they reach out to us for real-time management of all their care needs, and in return, we're able to leverage that data into our future. The patient would then be able to contact the triage care operator, relay their concerns. The operator would then relay the medical history, concerns, and relevant data to the on-call provider, who is also always accessible. The provider would then in turn give orders via a text-enabled platform to the operator. The operator then would carry out those orders via the same platform to our third-party vendors. What is this called? We have dubbed it STAT. While STAT in this form was incredibly effective, it did not have much in the way of automation. By definition, it was inefficient. In order to improve efficiencies, we began automating processes, utilizing the same text-enabled platform. We first tackled the goal of automating the processes behind the STAT operator. We utilize structured data, processes, and knowledge gleaned over the past several years in the creation of this feature. The goal? To effectively automate the tasks, responsibilities, and capabilities of the STAT operator, ultimately integrating this into the STAT platform and leveraging the quickly expanding field of wearable technology. Excuse me. Once completed, the patient will be able to contact Presidium's care partners at any time with concerns. These concerns, along with a structured description containing the patient's demographic data obtained from data repositories, real-time data obtained from wearable devices, and population-based data, again obtained from data repositories, will be relayed to the on-call provider. This is powered by Telium, and we thank Telium for their support in this respect. The on-call provider will then make an assessment and recommendations based on the data received. This information is subsequently sent back to the STAT platform. The STAT platform then synthesizes this information, subsequently carries out these orders in real time, all while updating the patient of the happenings. Now, we certainly understand the power of this feature. Yet, as data illusionaries, we are not yet satisfied. We understand that the clinician's decision-making is also dependent on these structured data pieces, and realize that over the past 30 years, clinical recommendations have been on an evolution of protocolization into algorithms. So I ask you, where is the role of the physician in all this, or the clinician? Are there benefits to automating these workflows? Is there opportunity to automate the clinician's workflows? The answer, an astounding yes. With the shackles of administrative work removed, we look forward to the clinician's role in patient care for the future. Will they have more time for compassion? Will they have more time for empathy? Or perhaps they may even have more time to once again enjoy the profession that they have entered. Ladies and gentlemen, this is why the future of healthcare is digital healthcare. And we at Presidium Health, well, we are your flux capacitor. Data illusionaries, come join us on this journey back to the future of healthcare. Some key takeaways from our talk today: healthcare is not sustainable in its current form. Data and digital platforms are the answer to healthcare in the future. Presidium, based on its experience the past 5 years, is very well situated as a pioneer in this data-driven healthcare future. And now I ask you all to join me in watching STAT in its current state.
There was the emergency room and the constant cry, "Call 911." But now those days are over. With STAT, you have real-time 24-hour access to a full triage team. How does it work? The STAT platform is faster than a trip to the ER because it's portable. It delivers x-rays, EKGs, labs, and meds via a healthcare team that comes right to you when you need it. STAT Alerts uses regularly updated cell phone technology to foster two-way communication. Your mobile medical team receives real-time access to your electronic health team records and basic vitals for quick and personalized care. Best of all, STAT Alert provides automated alerts for high-risk patients who fall or wander outside their home. Imagine health-grade services inside the home. Yep, covered by insurance. You might call it a giant step forward for healthcare. It's more a giant sigh of relief for patients. Presidium, on-demand medical care.
Thank you very much, Doctor. Thank you. Now let's jump into some quick Q&A to wrap up the session. So first, thank you. Great presentation. I mean, I've been very excited about this project from the beginning because typically when we talk about customer data platforms, we're typically talking about the marketing realm and retargeting, and this sort of parallel of a different type of customer experience for me is very exciting. And so again, thank you both, Doctor. So first, let's talk about the real-time data demands in the context of HIPAA compliance. So what is that causing you guys to focus on? What challenges is that creating for you, bottlenecks, et cetera, around this healthcare information exchange?
So because of our times, we're very fortunate in this respect. HIPAA compliance, as we all know, is with respect to encrypting data both at rest and in movement. All protocols, most of the new protocols, all already involve encryption with movement, be it if they're medical data or not. This affords us with a pretty good opportunity just because of the time to leverage that. Now, with that said, the other challenge from a HIPAA standpoint, in addition to the tech side, is the regulatory side, particularly with the ongoings of COVID. Right now, the HIPAA restrictions in terms of regulations have been completely altered for the time being. How they're going to end up, we don't know. However, we feel pretty strong with the team we have on board, both from a policy side, in addition from a tech side, that whatever comes up from a HIPAA standpoint, we'll be prepared for that.
Yeah, it's when we talk about the past and the present and the future, the idea is that a lot of these things we couldn't do in the past because the technology just wasn't there. But now it's really everywhere, and in HIPAA compliance, it's not a gap in technology. It's more a gap in the ability of the service provider. And so if you find service providers that can do and deal with HIPAA, it's a piece of cake. So how about the role of a customer data platform in your data supply chain for what you guys are doing?
Oh, I think that's the future. I mean, the health information exchanges are essentially trying to do similar things. The problem that they're all having, of course, is, again, regulations are getting in the way, inability to cross state lines and things of that sort. So what you have is you have a bunch of independent private companies that are smaller that are carrying on these tasks. We don't have a Telium per se with the infrastructure and ability to be able to pipe through and manage all these data points across the country. So what I suspect is as the regulations evolve and as these state boundaries start dropping off, there'll be a bigger role for companies like Telium to take over that role of the health information exchange from some of these smaller private companies.
Yeah, I mean, some of the early days of Telium, we talked about just the idea of understanding who the customer was. You have to have access to that data, as much of it as you can possibly can, as much as you possibly can. And now, as we look at sort of different activation techniques, some of them being retargeting and remarketing, but in your case, it's really about health and recommendation and reacting to symptoms. The idea is we still have to understand the customer. In this case, we have to understand the patient. So having all that data in one place is just paramount from a value perspective. How about, what have you guys seen? And a lot of these tools that are out there are building for more traditional web analytics type capabilities and e-commerce and Fiserv and travel and hospitality capabilities, and they're building tools that really cater to those those verticals. How have you guys found sort of putting your data? You've got this new type of data, this wearable data, this health signal data. Have you found challenges around that with some of the infrastructure and some of the stack that you choose?
Certainly. I mean, the challenge is that wearable technology, to be honest with you, from a software standpoint, is in its infancy. While the hardware is out there, there aren't too many integrated companies, integrated being the key word, that are providing the platform to take in that data and synthesize it and spit out something that's actually productive. So again, as Puya mentioned, this COVID phenomenon has accelerated that path, but certainly because it's in its infancy, it has been a challenge. And what we found is we've spoken to numerous vendors in the arena, and what we found in all of them is that essentially all of them had the same issue. There's no way for them to integrate their platform into a wholly used platform by that medical group. So all they're doing is creating more silos and more silos and more silos and more silos. So once they're able to integrate it into a platform that's able to take in all the data, well, that's first able to communicate all that data, then able to take in all that data, and has the tools available to synthesize that data and spit out whatever the case may be, whether it's clinical services, whether it's second recommendations with clinical decision making, whatever the case may be. Until that occurs, it's going to be tough for other vendors. What we have done, because this field is in its infancy and there's nobody with that stands above the rest in respect to a product that incorporates all these features, with the help of Telium, we have started building our own infrastructure in this respect.
Got it. So the last question I have is you guys seem to have bit off a pretty good bite here, right? You've taken on a brand new thing, a brand new movement, a brand new philosophy to healthcare, and you've also done it in the context of what I would argue is probably the highest risk category of patients, and also at the same time the least technology savvy people as well. So it's sort of a double challenge that there's ailments wherever you look, and you have to come up with something that's fluid and smooth and very very accepted by this audience. I would agree that if you can figure it out for these groups, it's going to be easy to get into some of the other categories where technology is just a logical extension. But talk to me about some of that. Will non-critical care become more regular and based on a steady stream of health information from wearables, instead of annual physicals?
Yeah, and let me Mike just mention our sort of rationale behind why when we chose the higher risk patients in the first place. And really it was twofold. Number one, these are the patients that put the greatest strain on our healthcare system. These are the top 5% that typically are the highest risk patients, most medically complex, that eat up half of the healthcare budget. And number two, it was the right thing to do. These are the patients that needed our services the most. And by taking on the most challenging patients first, we positioned ourselves to adjust our model to the other 95% of the general population. As opposed to our current high-risk population that depend on high-frequency visits, we envision a more non-face-to-face service approach, including higher streams of data collection from wearables and other peripheral devices to drive their healthcare needs. And as you mentioned, many of the challenges that we faced with our high-risk patients and the limited ability to interface with digital health devices should be dramatically easier with the general population that's more tech savvy.
Got it. Gentlemen, thank you very much. I look forward to never having to go to a doctor's office again, thanks to you two fine gentlemen. So keep up the good fight, keep up the good work, and thank you again for being part of Digital Virtuosity.
Thank you.